A warm welcome to all the listeners. Listen to the Blue Horse. Dr.C.K.N. is in conversation with Pooja. I'm sure you'll enjoy this session, and I'm sure it's going to be some food for your thought.
Welcome back, listeners. Mr. Blue Horse, I know you're doing fine, great as always. Yes?
Yeah, I'm good.
Always. Let's talk about medicines in this session. I mean, there are all sorts of illness, there are all sorts of supplements, there are all sorts of medicines you take to feel good, to get better, to sort out an illness. Can we actually depend on all of, is it dependable? Does it actually have an effect? You come across, like for example, like vitamin deficiencies are there, nutrient deficiencies are there, actual illness is there. Does medicine address all of this, Mr. Blue Horse?
Now, see, you have to understand one thing. There are innumerable, ever since humanity is living on this earth, created by nature. The medicine, whatever the medical science, is always a part of humanity, right? It's one of the big branch of human practice.
All right.
When I get hurt, when I break my bones, when I fall sick, when I get illness, right? What do I do?
Take medicine.
How to repair myself.
How to feel better.
How to fix it, rather. So we go for wars, we get hurt, right? We get bullets riddled into us, right? All that kind of thing. So you have to carefully understand one thing. It's an unimaginable, completely unimaginable for you or for any human to think the design of this human body.
Yeah.
Which is alive and functioning. You agree to this?
Yes.
I'll tell you an example. You must have heard about the pineal gland in your brain.
Yeah.
This one of the important gland. Secrete melatonin and serotonin and all that.
Feel good.
You know what is the size of it?
Tiny, I think.
Just little bigger than your eyes. Can you imagine? And we have to understand that fellow. It is in a cone shape.
Yeah.
It's hardly 2-3 grams. There's so much of work has been carried out by pituitary gland. And you know what is the size of it? Only a size of a piece.
Pituitary gland. Wow.
That's all. Your thyroid is only 10 to 12 grams in you. And if the 10 to 12 grams is not there, you're gone.
Yeah.
Like that, you can keep on going. Now, you are asking, can I depend on medicine? Right? Ever since humanity was there are various systems of medicines were practiced. The human brain, over a span of lakhs and lakhs of years, trying to understand the human anatomy, the human physiology, the human pathology, the food and nutrition, all kinds of things.
Right.
And what should I do when I am not good? Now, if you have a fever, they give you paracetamol to control the temperature, right?
Yeah.
So, world over, paracetamol has done the magic. But you remember one thing, there are people who are very smart. You don't need a chemical to go in and reduce your temperature, right? You have other ways. What Just ice cold water, take a piece of cloth, dip it, squeeze the water, put it chill on your forehead or keep it in your armpits.
Yeah.
Within a matter of half an hour, it will reduce your fever. You don't need paracetamol. There are many people who practice that.
Okay.
And fasting, if you take the Jains, authentic Jains, when they feel sick, they immediately go out of food. If at all they want to take something, they take a little bit of hot water.
Hot water, that's all.
That's all. Nothing else, no tea, no coffee, no substance at all.
When you're sick.
Yeah. They fast for 2 days, 3 days, 4 days till the sickness goes away. And it goes away.
Ouch.
I'm just telling this all for example, okay? So the Mexicans, the Brazilians, the owner of the American land once upon a time, 500 years ago, the Red Indians, right? Even the Scottish people, the Irish people, right? And all, European community, Russian community, the CSIS countries, like Uzbekistan, Kazakhstan, Kyrgyzstan, Turkmenistan, Azerbaijan, all these areas. Then the Mongolian, the Chinese, Japanese, one of the oldest human inhabitant subcontinent of India. A Tamil heritage, was a pioneering language in the world, and all kinds of tribes in Africa, number of countries in African continent, the tribals of New Zealand, tribals of Australians.
Yeah.
Only later on, the naval part of the search by the Europeans who have gone and anchored themselves in these lands and converted these countries of Australia and New Zealand. Previously, it has belonged to the Arunda tribes and all that stuff, and they are still there.
Aboriginals.
Yeah.
Yeah.
All these areas, whatever that I've been telling you, they have their own medicines, right?
Yeah.
Now, modern science, which came about 250 years ago, one of the most important medicines that they have made was morphine from opium.
For pain.
It was done by a German company called Merck. Merck till today, they have done it in somewhere in 1650 plus the morphine was made.
Wow.
Morphine was the first painkiller in the world by modern science. But it was done from a plant kingdom called opium, the poppy seeds. Till today, the Merck Pharma division is one of the richest companies in the world.
Yeah.
With one medicine, they made billions. Like, now you have huge amount of medicines based on pharmacology, right?
Yeah.
And you have traditional medicines too,
Yeah.
of every ethnic
Group.
civilization. They are practiced. There are people who go towards it. So it becomes a choice of a person to which area of science that he wants to go in and take his medicine.
Okay.
But actually speaking, there's one interesting fact I will give you now. As I said, the nature has designed this human, live organism, the human species, which is unimaginable at any given point of time for us to, think and understand and go anywhere near it, anywhere close to it. It is an amazing machine, right? But at the same time, the nature has also given hundreds and hundreds and hundreds and hundreds of mechanisms inside to recorrect yourself within your system when you fall sick. Do you know that? Body can repair itself. You don't need medicine.
But then how? Like for example, if you're having a wound and that gets infected.
Well, look, for wound care, wound healing, there is no medicine available in this world. It clears by itself. This is a very interesting topic you brought up. Say you fall from your bike and you get hurt in your elbow, it's quite a deep wound. Now you think you have medicines to cure it? No, you don't have any medicine in this world. Ancient Tamils had Sanjeevi. We'll talk about it later. Now there is a mechanism called migration of cell mechanism. Now in this elbow area, the skin is affected, the inner part of the dermis is affected, the fat layer is affected, the muscular tissues are affected, the blood vessels always smashed, Now what happens is, the in and around the area the good areas around the wounded place, cells of all types will, detach themselves from the network and come into the wounded area.
Okay.
And they start breeding themselves and rebridge the whole damaged part of your wound. That's how your wound gets healed. It's called migration of cell mechanism. What we are not in a position to understand here, when the human cells of all types, detach themselves from the network and come away, they have no oxygen and blood supply. Unless they have blood supply, they have oxygen supply. Right?
Okay.
Without blood supply and oxygen supply, they cannot survive. They survive. And where do they get raw material or energy? To reproduce themselves. Right? This is a puzzle. And suppose if this mechanism of migration of cell, wound care mechanism by the body, it's called, first they do the angiogenesis. What is angiogenesis? Construction of blood vessels back again.
Okay.
So this is very important.
Then why?
If suppose this mechanism doesn't work, then you are in trouble. It is an incurable wound. You have no medicine for it.
Okay. I'm a little confused. Why do we go to a hospital and get it treated, washed?
It is to protect your wound from not to get infected. That's all.
So if that's what I'm
coming
to.
I will further explain you this. I have gone and met with an accident and broken my arm. Now I go to the orthopedic area. They say it's an unstable fracture. We want to cut open, go inside and keep one small plate and screws and all that.
Correct.
So they cut this area. They go in and do the operation. Once they finish doing, keeping the bone together and screwing it up and all that stuff come out. And then this is called the surgical wound now.
Yeah.
The surgical cut. They suture it. Why they are suturing it? Keeping them close together so that the migration of cell possible, the mechanism will happen and heal itself. According to the theory of pathology, it takes 8 to 9 days for the surgical wound to heal. The surgical cut is called the surgical wound, okay? If the migration of cell mechanism fails, the surgical wound can never get healed. What are you going to do? You're gone. You have no answer.
Yeah.
That means what you know. In no system of medicine, you have any external application available to heal your own. It heals by itself. Why I'm telling you this body's mechanism, what we are not able to understand is how can the cells detach themselves and stay alive, and how come they, breed their population without any support. We cannot understand.
Mystery.
In modern science. Ancient science were fantastic. You take the Tamil heritage, Lord Agastya has given Sanjeevi. It's a coconut-based oil with a lot of ingredients. As I said, this surgical cut takes 8 to 9 days for the theory of pathology. It takes so many number of days for this migration of cell mechanism to work and heal the wound. If you put Sanjeevi right from the beginning after your surgery, within 48 hours it will heal. It will disapprove your theory of pathology, what you have in your modern science.
Why is it?
It's so fast. It makes the migration of cell mechanism work faster.
Why is it not practiced more then?
And then the cut area, the thickening of the skin, the cut mark will not be there.
No mark.
No.
Wow.
Say for example, after 10-15 days, the surgical cut has not healed, it becomes an incurable wound. You have no mechanism whatsoever with your techniques of all your pharmacological expertise. You cannot bring in a component to heal this wound. Now Sanjeevi come into play. It will heal it. This heals this incurable wound. There are 42 types of incurable wounds in this world for which we have no answer so far.
42 types.
For example, vascularitis ulcers. You must have heard about varicose veins.
Yes.
When they go bad, they break and they become a wound.
Ow.
It cannot be repaired. It cannot be healed. You got it?
I didn't even know it happens.
Yeah. So now you're talking about medicines. So why do I need medicine? Do I depend on medicine?
Can I? Yeah.
Can I depend on medicine? You have no choice. You have to depend on medicine because the fear come into play.
All right.
Or the self-centered activity of the brain, which we have already spoken. I need to come out of my illness much faster. Recover myself much faster, right?
Yeah.
And whatever medicine given, I just pop it. Most of the medicines you pop it heals you more with the aspect of the placebo effect.
Oh, really? It really has no functional...
It has more than that, the placebo effect. Medicines are available today with the help of area of modern science is to only treat the symptoms, give you symptomatic relief. Say for example, if you are suffering from asthma, I don't have medicines to cure your asthma in modern science. You are struggling for breathing. You are struggling, with wheezing, right?
Yeah.
So what do? I give you oxygen support if it is very bad. Because of the inflammatory load which is narrowing down your air pipe from the nasal to the lung, and the air pockets in the lung is more filled with liquids or phlegm or whatever you call it. So I have lesser capacity to, breathe in and, send more air to my air pockets because they are filled with liquid. So our body needs more oxygen or required oxygen, which is not happening. So I tend to breathe harder and more and more. So I give you some steroid-based puffs to clear this inflammation. I'm giving you symptomatic relief. I can take it as and when I am struggling, that's all. The cause of the disease is unknown. When there is a cause of the disease is unknown, you have no remedy for it.
Yeah.
So when you go under the pathology of the modern science, the disease classification of diseases, most of the diseases for which the cause of the disease is unknown.
Yeah.
Once the cause of the disease is discovered or found, within no time they can bring in medicines to eliminate the cause. Right?
Right.
We don't have. So we rather go by the symptoms, right? The symptomatic relief. So for example, if you're suffering from IBS, irritable bowel syndrome.
Yeah.
So if you're suffering from irritable bowel disorder, IBD, or Crohn's disease, it is the inflammatory part of the intestines. or ulcerative colitis, your colon getting, lot of ulcers. These are all intestines related problems. They are all psychosomatic disorders. And you have no medicines whatsoever. People suffer for 15 years, 20 years, 25 years, 30 years.
Yeah.
They become thin, they lose their weight, they keep having a lot of loose motions, they keep having, passing stools number of times in a day. They can't travel, they can't freely go anywhere, they can't, go to any function, any marriages, any parties.
Right.
By suffering so with IBS or IBD or Crohn's disease or ulcerative colitis, they become sick and sick and sick and sick. And this is going to be a lot of bleeding in your stools. And they it is going to really make you anemic, of your hemoglobin down. That's going to, lead you to loss of appetite because the gastro cannot function without proper oxygenation and blood supply. Now, where do you have medicines for all these things? You have no medicines whatsoever anywhere in the world. I worked so hard for 6 years and developed medicines and have cured hundreds and thousands of people. These are from the traditional science side of it. So if you're going to ask, can I depend on medicine? You have to depend on medicine. You have no choice. Because minimum you need the symptomatic relief to keep yourself comfortable.
Yeah.
Whatever the critical part that we've been discussing, that cause of the disease and cure for the disease and all that kind of thing, keep all aside. But the point which we have to think here is the benefit of the patient.
Okay.
You have to, think of the benefit of the patient, right? If he is suffering from pain, give him some painkiller and relieve him. Keep him comfortable. No matter these painkillers may have its own side effects, but the doctors know what is the dosage can be given to the patient. Overdoing any medicine is not good for any one of us, that everybody knows about.
Yeah.
Okay. And this one thing, can I depend on medicine? What I would like to say in the end, don't ever go by your own way of medication. You understand what I'm saying?
Absolutely.
Self-medication without the consultation of the doctors.
Yeah.
It's very dangerous.
Agree.
Because you will not know what is the dosage you must take.
Yeah.
And of course, to live a life without depending on the medicines, without having medicines on a daily basis, is the best way of living. If you call me, can I depend on medicines? At the moment, in this world scenario of modern science developing in every field, everything is polluted. The human health has come to, a big, uncompromised question mark. Everybody is suffering from something or the other.
True.
We have to live a life without any choice or to depend on some medicine or the other to keep ourselves comfortable. Thank you.
Thank you, Mr. Bluehurst. So, we have to depend where there is no other go. Just probably try to live healthier, reduce all the stress. Whichever way possible, try to live healthier is the only thing we can focus on. We should dedicate that amount of time for our own well-being. On that note, we are signing off. We will see you in the next session.